Hello, and welcome to our poster session, Registered Nurse Shortage in New Mexico, Systems Dynamics Modeling as an Innovative Approach to Strengthening the Workforce here in New Mexico. I'm Dr. Melissa Cole, Associate Professor here at the College of Nursing, University of New Mexico. I'm joined on this project by Dr. Jan Martin and our Dean Casper. Upon attending the International Systems Dynamics Conference last year when it was here in Albuquerque, we were inspired to begin exploring systems dynamics and started meeting with a group of interested students and faculty. The issue that we're presenting today is our work in progress, and we are very hopeful that with your help, we can begin to launch some modeling, some ideas, and continue our work in this area that we're starting around how to improve the nurse shortage. So I'll walk you through where we're at, and we welcome your ideas and feedback as we look at this work. Looking at the background here, I'll make it a little bit larger, hopefully, so that you can see it here. We've had some critical shortages despite the fact that we've added 13% increase between 2012 and 2018 to the workforce. And employers are, really challenged by this deficit. What's really accelerated it, of course, is with the onset of COVID. There's been an expenditure of, even without the onset, there's been an expenditure of $75 million on travelers. Those travelers are RNs coming into our state from out of state, which we obviously spend an exorbitant amount on. That is expected to double because of COVID across the next year. Now, looking at what our methodology challenges have been, and actually why we're looking more to system dynamics. We've been looking at a population-based algorithm, and that algorithm DOH has been using from 2013 to 2019 through last year. And it was adapted from a national rate of looking at how many RNs for a population of 100,000. And that was really looking at a rate that was helpful from the Kaiser Family Foundation, looking across the United States. And it was not necessarily looking at rurality, not very accurate from what we looked at as far as benchmarks that were reflected for us in our state. And only 60% of working RNs work in hospitals. So that we are really looking at how can we find a more reflective approach of the nurses that work within New Mexico, and really addressing the fact that we were putting more RNs in and really not getting our needs met in New Mexico. So last year, the approach moved to a more sector strategy and regional sector strategy by what industry and what areas, what were those needs. It gave us an opportunity of really strengthening that approach and talking to employers in different regions. That's a very employer-centric approach, and we'd like to look at expanding that to be maybe perhaps a bit more community-centric approach, or much more integral, which is why, as you can see, we're evolving to a bit more of a system dynamic way of looking at things, which is a little bit how nurses think in problem solving, but this is a unique way for us to be looking at solving this problem. Looking toward how we're looking at this in being unique and urgent, very urgent right now, considering COVID-19 is accelerating the need for healthcare workers, specifically nurses, across New Mexico and certainly across the country. One could argue across the world. Nurse employers, each community, as mentioned, has very unique needs. Also, what's unique is New Mexico recognizes advanced practice nurses, which means you could see a nurse as your primary care provider here in New Mexico. Also in New Mexico, we have increasing programs in high schools that provide opportunities for students to not only enter in the workforce as an RN, but also looking at LPN programs, licensed practical nurses. Licensed practical nurses were beginning to be phased out. That can be looked at as a bit controversial, but at this point, I think it has been argued that having kind of an all hands on deck approach has also been at least helpful, and how can we get some of those LPNs into a more advanced nursing practice might also be helpful. So, systems dynamics. This is why we're attending, why we're here, and why we're very grateful for your help. This is a model from an inspirational article we found that I'd like to turn our attention toward. Morgan and Graber-Naidich was very inspirational to us, considering that they've looked at a very rural area in Ontario, Canada, with a similar problem, but they were focusing toward physicians. What we found helpful is how they address their disproportionate concentration of healthcare professionals in urban areas, very similar to our issue. And we're able to then look at that for rural areas. Their modeling, which we see here, is what we've used, and we seek your help in looking at how we can look at that. Historically, DOH has been looking at predictive modeling, and we understand that that's really not what we're looking at. We're looking at a parallel to how we can look at how we can initiate collaborations, create policy, and strengthen the rigor of how we're looking at this policy, and how we're looking at this modeling, and how we can help develop policy, and more importantly, how we can really strengthen the workforce here in New Mexico. What we could do here at the college to look at this modeling and support efforts in collaboration, ask the right questions, how we can develop a model to help focus our efforts to improve what we're doing here in New Mexico. Thank you so much for your time and attention, and anything you can do as far as providing feedback, we're open. Anything you need from us in healthcare, we're happy to help. Thank you. We look forward to the conference.